Bismillahirrahmanirrahim. Assalamualaikum and good morning to Miss Idayu. Today I'm KHAIRUNNISA and with my partner which is Hayyu MAWADDAH. Will present an issue that million worldwide, which is global child mortality trends and risk of death. So, first thing first, global child mortality remains a critical issue, often overlooked despite media coverage. Between 2000 and 2003, 170 million children died before age 5, based on the data UNICEF 2024. Which is why this is important to we get know about this is because even when news story about child deaths, people may not realize just how large problem is. And perhaps that 170 millions is an enormous number, comparable to losing entire population of several countries made up of children under 5. That's means on average more than 7 million children die every year. Imagine what is will means to lose almost a whole population of Malaysia in less than 10 years, just from children under 5. Next, about the credibility, which is reliable data from NIFES, WHO, and the World Bank, based on certificate national records and survey, report the suggestion of addressing child mortality. This assign guide government actions in improving health system and prevent deaths, which is it show that statistic constant discussion are just not opinion. They are came from a well-known trusted organization, like I mentioned. This group collect information from country official records, which is through a survey too, because the data is very reliable. Leader around the world use it to make an important decision. For example, if the country notice through this data of one of the reason many children of dying, such as because of the lack of water, such as like this report, one of the reason, so that the government can plan a program to fix the problem. So for the next, which is the background of the topic, will pass to Hayyu Mawad.
Okay, thank you, Kai. Now I will continue to present about the background of this topic. Okay, the definition of this topic is the under 5 mortality rate, which counts the number of children who will die before turning 5 per 1,000 live births. It is a common means to determine mortality, which is defined as the overall rate of death within a community by UNICEF in 2024. This measures how many children die before reaching the age of 5 per 1,000 live births. It is widely used because it reflects the overall health of a community. If many children die young, if it indicates deeper problems in healthcare, nutrition, and living conditions. Then the key causes include malnutrition, poor immunization, unsafe water, and limited healthcare. Poverty, low maternal education, and inadequate environments also contribute. For example, children who don't get enough nutrition are more vulnerable to infections and slower recovery. Malnutrition also can weaken the immune system, and also unsafe water often cause diarrhea, which can be dead to babies. Next slide is the central idea. In 2023, most child deaths occur among children under 5, especially newborns, due to biological vulnerability and unequal healthcare access to healthcare services during pregnancy and early childhood. These factors make the earliest stages of life the most critical period for survival. Next slide will be presented by KHAIRUNNISA.
So next we will look to the chart, which is bar chart, about the global mortality rate and the number of death. We can see if we look closely the graph, which is we will notice the most death occur under age first, especially among the newborns in the first week of life. Why this is happen is because newborn are biologically very vulnerable and in place with the poor prenatal care, and this can also affect the babies can get a malaria, diarrhea, infection, and breathing problem are common cause. Why the graph is increased and the facts neonatal that lead to child mortality. Mainly from prevent issue like premature births and poor prenatal care. But at the same time, we can see the study also shows something positive, which is they are fever that the older children age 5 to 40 years old. This is because they have one program that made from United Nations, which is Sustainable Development Goals, which is they do a program to focus on this community, which is to get a better healthy nutrition and vaccine for infants and support for mother and babies. We pass to back to the Hayyu Mawada to explain the next chat.
Uh, Next chart is multiple line graph. The title of this graph is probability of dying among young people. Okay, this graph shows the significant differences in mortality rates between regions of the world, with the highest rates particularly in you can see sub-Saharan Africa and South Asia. The data is sourced from UNICEF in 2024 and Duke 2024. Uh, the probability of death for our 5-year age groups among children, teens, and young people in the SDG region worldwide 2023. If SDG efforts are not bolstered, child mortality in sub-Saharan Africa may increase. Next is high mortality rates are still a result of avoidable factors like improper nutritional intake. Okay, many children die from conditions that are entirely preventable with proper nutrition. And lastly, is due to preventable illness and the delayed improvement in neonatal care. Newborns are at the highest risk. Newborns are especially vulnerable in their first month of life. Okay, the last slide is the conclusion. Okay, educational institutions may help by informing parents about the importance of proper nutrition for their children. Okay, for example, schools and community centers can organize health tasks or distribute easy to understand guides on child nutrition. When parents are equipped with the right knowledge, they are more likely to make informed choices that protect their children's health. And last but not least, is government and NGO may collaborate to ensure healthy food is delivered to the vulnerable society. Joint efforts can include food aid programs, mobile health clinic, and nutrition campaigns in rural areas. By working together, they can reach families who lack access to proper meals and ensure children receive the nutrition they need to grow and survive. Okay, and that's all from us. Okay,
All right.
thank
Okay.
you.